Preceptor for the grant. And as many of you know and participated in, and I would really like to restate Kay's thank you to all of you who participated and have, even since we've developed the curriculum, participated in input to the curriculum. The employer's input, whether it was being on a committee or through the rapid response, all of you have really guided the nursing curriculum development. And so we really want to thank you very much for all of your participation, because it is nurses for your facilities that we are educating. So we thank you for your participation. So as many of you know, we did revise the practical nursing, the associate degree nursing, and then the registered nurse to bachelor's in science in nursing education program and pathway. The practical nursing program is now 3 semesters and is being offered in a distance fashion through Great Falls College and City College. The lecture and Flathead, who is actually using it and developed it in a pilot program with Libby. The lecture is provided, or classroom, if you want to call it that, is actually being developed and delivered online with some synchronous and asynchronous components to it. The majority of the nursing lab is completed in on campus, with students coming intermittently for a day at a time or several days at a time. And then with the clinicals, the programs are working very hard to work at helping the students complete these hours within their community, or at least at a facility that's closer than sometimes traveling all the way to the college campus. As many of you also know, this is a work in progress, and we have had many bumps along the way as we've launched it, and we have learned so much. But I really and truly have to give credit to these colleges for the work that they're doing to try to meet the needs of both these students and the employers. So next slide. Thank you. So we really, the prerequisites to the distance program was started in the fall of 2016, with the first group of practical nursing students being accepted into the distance programs in the spring of 2017. We have had good success so far. As you can tell from this map, this is the communities of which students, whether in the prereqs or actually accepted into the program, are from. There has been a lot of misconceptions with the program, as some of you know. Especially students feel sometimes that because we decreased the credits and we put the PN in a distance fashion, that this would be a quote-unquote easier education round. Nursing education is rigorous and it's hard. We are talking about patient care, and we're talking about patient care within each of your facilities. And so we did not decrease the expectations or competencies or learning outcomes that students need to meet. And so there's been some learning around that, and we are working really hard on advising and coaching ideas to help students get a better understanding of this. We do have great student success stories, as was presented at our full curriculum meeting with a student from Shodo, who shared with us that this distance program has allowed her to become a nurse, that due to family situation, relocating was not possible. So this has been good for her family, for her employer, and for her community. We also heard an employer success story presented from West Yellowstone Clinic, where they have been searching for a nurse for the past 3 years. They have an employee who is in the Great Falls College nursing program, and when she's finished, she will be able to be employed and know the culture of West Yellowstone and their patients and be able to fill that position that's been so difficult to fill. Again, there has been lots to learn, and both of the colleges have been working hard to respond to the students' needs for closer clinicals sometimes and for the employers' needs. So if you have a student, please work with the college that your student is enrolled in, and they will respond as best possible. So the next slide shows the fact that some of you participated in our, what at the time we called our Clinical Resource Registered Nurse Training Program. We put on a go-to-meeting educational component, and one of the biggest things that we heard is that, especially for you rural communities, it is very difficult to dedicate a nurse to be a CRRN when all they can focus on is the student and not have any facility responsibilities, and also a difficulty of financial support of this position. So we took that back and we worked hard on finding a way to work with that, and we have added a preceptor and component where the nurse can work with the student while participating in their daily patient care assignment. I'm happy to say that this Saturday, April 8th, at Great Falls College, we are having our first Preceptor CRRN training. We have 22 participants who have signed up. We have lost a few of those because of staffing and not being able to free up a nurse to go sometimes, but we're trying to make sure that all the resources are sent out that need to be, and that we will also be recording this preceptorship CRRN training, and that will also be made available. So the next slide. So this slide, a couple things to share. I don't know if you have heard yet about the Montana Mobile Simulation. DPHS received a grant to have actually built 3 simulation trucks, and this is a picture of what these trucks look like. Inside these are absolutely top-notch recent simulation equipment for an adult, for a mom who can deliver babies, for a child, and for an adolescent. And the primary goal of Mobile Sim Montana is to provide education and training to rural EMS services in hospitals. Governor Bullock will be actually doing a kickoff at the state capitol on April 24th, and you will all probably be hearing about that through DPHS. There's also an integrated simulation, a nursing education conference happening at Montana Tech on May 16th and 17th, and there is a $50 charge for that. Continuing education credits will be provided. This is nursing education focused, but there is also a component and some breakout sessions that employers can attend because simulation can be done not just in a formal education setting, but is also very good for in-services and workshops that you might have within your own facility. And next, I think that, okay, that might be it. Does anybody have any questions for me at this point?
So if you do have questions, feel free to open up your mics and ask them, or you can chat them into the chat box. We'll continue monitoring the chat box and respond to your questions as they arrive. And also, too, for those of you that have joined just recently, if you wouldn't mind, please typing your name and your facility and anybody else that's in the room with you into the chat box so that we can actually know for sure how many people participated. And I have a question here from Marlis that says, so if we can't send someone for Saturday, can they still get certified as CRRN through the recorded version?
So, you know, you don't really have to become quote unquote certified. And the answer to that is yes, they can. You don't actually have to participate in the training. Some facilities have had students and we don't want to do a repeat of the whole process for you. What this is for is because we know that all of your employee nurses are excellent care providers, and we're wanting to help them transition into learning how to add to that being a nursing instructor in a clinical setting. And so if they use the Nurse TIM modules that are out there, which they will get continuing education credits for, and if they go through the material and you have that nursing instructor resource book that, Marlis, we've actually sent out to you already, so you should be receiving it at the end of this week or early next week. With those resources, they should be ready to be a preceptor, and you can work with the college, Preceptor or CRRN. Yeah, and you can work with your college on any specifics that they might have or requests that they might have of you.
Marla says, fabulous, thanks. Okay, great. Any more questions, just feel free to chat them or open up your mic. And now I'm going to turn the presentation over to Neil Moisey.
Thank you, Kay, and welcome everybody. I'm the director of the core curriculum